Good afternoon, everyone, and thank you for joining us for today's media event. Initially, each attendee will be muted. After the presentation, we will take one question from each member of the media. Use the raise hand feature to ask a question. On the computer, the raised hand button is located at the bottom of the participants list. If you're calling in, press *9. When it's your turn, we will unmute you and ask you to proceed. You may also type your questions into the chat function. We will also hold any Spanish language questions for Dr. Ligon until the end. You have our permission to record if you're able, and we will have a copy of the recording available upon request. On today's panel, we have Dr. Fermin Ligon, District Health Officer here at the Southern Nevada Health District. At this time, we will begin with Dr. Ligon. Thank you.
Okay, thank you, Corey. Okay, good afternoon, and thank you for being here with us in this kind of short notice. So, I am Dr. Fermin Ligon, the District Health Officer, Southern Nevada Health District. We want to talk today about certain mitigation measures that we are recommending. First, I want to say that until today, we have more than 268,000 cases of coronavirus reported here in Clark County, and also that we have seen a steady increase in the number of cases reported here in the last few weeks. Regarding our vaccination campaign, we have initiated the vaccination in more than 1.1 million residents in Clark County. And we have more than 947,000 people already fully vaccinated here in Clark County. Regarding the distribution of this vaccination, right now we have 64% of the adult population, meaning those who are 18 years old and over, who have already initiated the vaccination here in Clark County. And when we look at the whole spectrum of the eligible population in Clark County, we see starting at 12 years old and over, then that percentage of vaccination goes to 58%. Despite those levels of vaccination, still we are suffering for this recent increase in the number of cases in Clark County. Because of that, today the Southern Nevada Health District is making the recommendation that both vaccinated and unvaccinated individuals should wear masks when they are in crowded public settings. And by those crowded public settings, we are referring essentially to indoor settings, such as grocery stores, malls, large events, and casinos, as a step to fully utilize the tools that we have available to stop the pandemic. So we still are working strongly in our vaccination campaign, and we are offering the vaccination at multiple sites in the community, and we are expanding even more further within the community the vaccination opportunities. But that's not enough today if we want to completely decrease the recent surge in the number of cases that we are experimenting here in Clark County. The use of masks correctly actually have proven to be to be effective in helping prevent the transmission of COVID. We want to say that this is a recommendation from the Southern Nevada Health District. It is not a mandate, but it's something that We are sharing with you and sharing with our community because we need the collaboration from all our community members and as well as the business community here in order to make this effective so we can completely decrease the number of cases that we are seeing right now. I will stop here, Corey, for questions.
As mentioned before, today we will take one question from each member of the media. If you'd like to ask, please raise your hand at this time. The raise hand feature is at the bottom of the participants list, or hit *9 if you're calling in. Our first question today comes from Mary Hines. Go ahead, Mary.
Thank you. Yeah, I was muting and unmuting there for a moment. Good afternoon. Is this a measure designed to protect people who are unvaccinated or people who are vaccinated? And is this a step in the direction of mandating a mandate? Do you envision mandating rather the wearing of masks? Do you envision that happening?
Okay, thank you, Mary. Well, this is a measure that directed to protect all individuals here in Clark County. The main target is, of course, the unvaccinated people because they are the ones who are at higher risk of transmission of the disease right now. And our data shows that more than 95% of the cases and admissions that we had recently here in Clark County are people who have not received a single dose of the vaccine. So that's our main purpose. And regarding a mandate for that, at this point we are making this a strong recommendation to the public and our business community. And it's something that we could consider with the local authorities contingent to what is the response that we see in the next few days. Thank you.
Our next question today is from Astrid Mendez. I'm muting you now.
Well, doctor, for some people, this seems kind of like a setback because unfortunately, there's a misconception that if you have vaccinated, you are basically protected from COVID at all. So the fact that that now people will try to follow this recommendation, some people obviously are against it. So will this mean that it could be a more dangerous situation for everybody?
Thank you for your question. Well, it means that we want to ensure that there is a better protection for everybody in this community. One of the challenges with the current recommendation from the CDC for vaccinated individuals is that nobody has the authority to actually ask a person who is without a mask whether this person is vaccinated or not vaccinated. So it creates a challenge, especially when in a situation similar to where we are right now and where we know that there is an increase of transmission in our community. And we know that we have a relatively large proportion of our residents who are not vaccinated. So in order to make sure that we are decreasing the possibility of transmission of the virus, especially on indoor setting that's where it is more easily transmissible, we consider that we need to come with this recommendation just to make sure that everybody who is attending any of those public settings is at least decreasing the possibility of transmitting the virus to those around them if they happen to be symptomatic, but even people who have no sign or symptoms, still, if they are infected, could transmit the infection to people around them. So just because we have this high proportion of unvaccinated people here and in our community, at this point, we consider it's important to request that use of masks until we see our numbers decline and the vaccination goes up. Thank you.
As we continue to call on you, be sure to identify which media outlet that you're representing, please. Our next person is Joe Moeller.
Yeah, this is Joe Moeller from Channel 8 in Las Vegas. Question here. You just mentioned you're going to be monitoring this over the next few days, the response that you're going to be getting. What will it take, or what is the next step, or at what point could you see the Nevada Health District actually implementing a mandate?
Thank you for your question. Well, in order to implement a mandate, that will require the active collaboration from the local authorities, meaning the county or the state or the cities. The health district itself doesn't have the authority to implement a mandate of this nature. So that would be something that we have to be in collaboration with the local authorities here. Thank you.
Our next question today comes from Caitlin Newberg. Trying to unmute you, Caitlin.
Hello.
There you are.
Okay. Hi, everyone. My name's Caitlin. I'm with the Review Journal. So what is the health district's data and modeling looking at right now as far as how high the disease metrics could rise? And when could we expect the metrics to start going down again? Is it just a matter of more people need to be vaccinated?
Okay, thank you for your question, Kathleen. Well, our numbers so far it show a positive trend, meaning that the expected number of cases is going up. We have some modeling data also looking at few days ahead from today, and that model still shows an expected increase in the number of cases because again the capacity of transmission of the virus, the way that it's estimated still is over one, meaning that the virus at this point in Clark County is able to reproduce more than one at a time. So that's a positive trend. I guess that was the question, right? Corey, did I miss something?
I'm not sure. Caitlin, re-raise your hand if we missed the gist of your question, and then we'll come back to you. Our next question today comes from Jacqueline Schultz.
Hi, doctor. How can you describe for us how hospitals are doing? And then in terms of handling cases, and then in terms of all the new cases, how much are young people? And are we seeing the Delta variant perhaps affect younger people more severely than typical? If you could give us an idea of how this is playing out among populations here in and out of the hospital.
Okay, thank you, Jocelyn. Okay, we're looking at the data with the hospitals, and actually we have met with the hospital leadership this week actually twice. Have been talking with them about the situation, just to make them aware of what the health district is looking at, and share information with them about the incidence of the disease, our expectations, and also looking at from the hospital side, what are the needs and expectations so far. So, but what we are seeing is there is a mild increase in the number of hospital admissions related to COVID in our community, but that increase is not at the same level than the increase in the number of cases that we see in the community, and it's not similar to the increase on the number of admissions that we saw during the winter or summer. Having said that, also I have to tell you that at this point today, our hospitals are working at a good capacity. They are not at risk of being overwhelmed by the admissions related to COVID as today. They are performing the usual practice, but they are looking closely at this situation. Regarding the younger population and Delta, what we are seeing in Clark County is that most of the cases that we are reporting every day are younger people. Most of them between the 18 up to 45 years old. Also, again, what we're seeing is that most of those individuals that are being diagnosed with COVID today are not vaccinated. And that's a big challenge for us, because right now our vaccination campaign, our efforts are being directed towards that specific group. We are trying to work in new communication tools and new ways on trying to engage that segment of the population. That right now, again, that's a big challenge, and we are trying to really gain grounds within that group. But we also the county, the cities, the state, we are looking at different ways on how to bring the vaccination campaign deeper into the community, but also more easily accessible to the population at large, but with an emphasis to that younger segment of the population. Thank you.
Since today's media briefing is shorter than usual, in a moment we will move on to the Spanish language portion. If you are with the Spanish language media, please raise your hand at this time. In the meantime, here's the other part of Caitlin's question. She asks, do you have any idea when the disease metrics could decrease again, or what would have to happen for the trends to decrease?
Oh, okay, thank you. Okay, at this point, we don't have any evidence of when the current trend in the number of cases will decrease. So we don't have that level of forecasting available. So the answer is no. We don't know that will happen. And in terms of what we are going to do, well, precisely what we're doing today with this recommendation for the use of masks for vaccinated and unvaccinated people in public settings, mostly indoor settings. That's one of the steps that we are looking into that mitigation, and of course, contingent to how we see the progress of the disease in the community in future days and weeks. There could be additional measures if that's necessary. We also are are pushing for our vaccination campaign, and the farther than we advance in our vaccination campaign, the better off we are in terms of decreasing the risk of transmission of COVID in our community. Thank you.
Thank you, Dr. Legan. We do have a question from Alejandra Ochoa. She's raised her hand. But first, did you want to give an overview in Spanish?
Okay, so, we'll start with Spanish.
Thank you, sir.
Buenas tardes. Mi nombre es Fermín Leguén, director de salud del Distrito del Sur de Nevada. En el día de hoy estamos reuniéndonos aquí porque queremos comunicarles a ustedes nuevas medidas recomendaciones que queremos hacer para tratar de disminuir la transmisión de coronavirus en nuestra comunidad. Quisiera decirles que hasta el día de hoy, en el condado Clark, se han reportado más de 268,000 casos de coronavirus desde el inicio de la pandemia. En cuanto a la vacunación, nosotros hasta el día de hoy hemos iniciado la vacunación en más de 1.190.000 personas en el condado Clark, de las cuales 947,000 han completado sus 2 dosis de vacunación o si es en el caso de la Johnson & Johnson, pues la única dosis que lleva. Eso significa que el 64% de los adultos en el condado Clark, adultos significa personas de 18 años o más, han recibido al menos una dosis de la vacuna. Cuando miramos a las personas elegibles para la vacunación en el condado Clark, que es el grupo de 12 años de edad en adelante, el porciento de personas que han recibido al menos una dosis de la vacuna en el condado es el 58%. A pesar de estos niveles de vacunación en el condado, aún así, en las últimas semanas hemos experimentado un aumento en el número de casos reportados diariamente. Es por eso que el Distrito de Salud ha decidido en el día de hoy hacer la recomendación de que tanto las personas que están completamente vacunadas, o sea, que han recibido sus 2 dosis de vacuna Moderna o Pfizer o su dosis de Johnson & Johnson, así como las personas que no se han vacunado, nosotros recomendamos que deben usar la máscara en sitios públicos. Y en los sitios públicos que nos referimos es mayormente sitios de establecimientos como los groceries, o sea, supermercados, los malls, también eventos grandes que se ofrecen aquí, ya sea festivales, conciertos, eventos deportivos que son dentro de un edificio y no espacios abiertos, así como hoteles, casinos. Recomendamos que en todos estos sitios públicos, si usted ya esté vacunado o no vacunado, que por favor se ponga la máscara. Y esto es importante porque esto es una medida que contribuye a disminuir la transmisión del virus entre las personas aquí en el condado. Okay, I will stop here, Corey, and then we'll go to the questions.
Okay, we've got a question now from Alejandra Ochoa. One moment, please. Unmuting you now.
Buenas tardes, doctor Leguén. Alejandro Ochoa de Univisión. ¿Me escucha? Sí.
Sí, sí.
Sí,
Sí,
ok.
por favor.
Gracias por el resumen en español. Seguido a esto, yo no sé si ustedes tienen algún reporte de cuántos casos se han registrado en nuestro estado de la variante Delta. Y además de esto, ¿por qué las autoridades de salud no han decidido hacer mandatorio el uso de mascarillas sabiendo el riesgo que potencialmente se está corriendo con este virus? Gracias.
Ok, gracias Alejandra. Con relación al virus Delta, nosotros hemos visto un aumento en la circulación del virus, sobre todo desde la primera, segunda semana del mes de junio. Este virus ha ido aumentando progresivamente y hoy en día es el virus que se diagnostica con mayor frecuencia en el condado Clark. Yo no tengo el número de casos que han sido reportados con el virus Delta aquí en el condado en estos momentos, pero sí sé que la cifra es superior a los 600 casos hasta hace 2 días. Hoy día no tengo el dato enfrente de mí, pero sí te lo podemos comunicar después que terminemos aquí. En cuanto a la medida que si se hace mandatoria o obligatoria aquí en el área, nosotros como Distrito de Salud tenemos la autoridad para hacer la recomendación, que es lo que estamos haciendo hoy, una recomendación bien fuerte a nuestra comunidad acerca del uso de la máscara, tanto para los que están vacunados como los que no están vacunados. El paso siguiente sería hacer esto de forma mandatoria. Nosotros para llegar a ese nivel de hacer esto de forma mandatoria, tendríamos que contar con la colaboración de las autoridades locales y entonces ellos emitirían esa orden. Gracias. Okay, Cody.
Thank you, Dr. Ligon. That's our last question for today. So with that wraps up today's briefing. Thank you to everyone who joined us today. We hope you have a great weekend. And remember, mask up and vax up, and we'll see you soon. Thank you.
Thank you.